we found out that infant mortality is in some slums almost 3 times the national, level. So, for instance, where the national level was around 79 in Kenya, there were some slums which had as high as 250 children dying before their first birthday out of 1,000. So, when we're doing this demographic surveillance, we are sort of confirming, these numbers. They're not as high, of course, because the slums are different, but still, our estimates are always higher than the national estimates, and even the estimates, the rural average. The most surprising thing is what we are finding in terms of aging, that there are old people that are aging within the slums and have no plans whatsoever of leaving these slums and going back to their rural areas. That is quite surprising, because we've done some studies among older people, and 80% of them don't plan to go anywhere. So that's a bit surprising, because it has always been assumed that when people retire, they live maybe for a few years in the urban areas, and then they always go back to their places of origin. But this return migration phenomenon is not being confirmed. So that's a bit surprising. But still more surprising is the magnitude of the ill health within these, informal urban settlements. So as I said, for instance, for childhood mortality, the rates are always maybe 50% higher than what you'd expect for the whole of the country. For maternal mortality, it's the same, almost 50% higher than the national average. So the magnitude of ill health is just astounding in these settlements. Yeah, I think in the last 5 years we've seen more and more global players trying to, at least having some programming with an urban focus. But it's not always been like that, and I think more could be done. For instance, it's a myth. I mean, when we ask the people that come to these slums, especially the women, most of them come because they think that they'll get more access to social services, whether it's schools, whether it's healthcare. But then the reality is that those services don't exist. Because especially in Kenya, in other areas it may be different, but most of these are informal settlements, and by nature they are illegal, quote unquote. So it's not easy for governments to put in infrastructure in these areas. So you have such small areas with millions of people. The population density in the area where we do research is about 60,000 per kilometer squared. So even with existing infrastructure that is not within the slum setting, it's almost impossible for it to cope with these numbers. But then, even with such small, geographical areas, the distance between one's home and the health facility may be less than 1 kilometer, but it still may be inaccessible because of insecurity. So, for instance, we know that mothers who go in labor at night cannot dare go out of the house to walk the 1 kilometer to take them to reach a health facility, and the narrow roads make it impossible for any kind of ambulance service to operate. So much as the geographical distance is not so much, still there are other barriers. There are other social barriers within the system that prevent people from accessing these services. So, for instance, we find that for children who are sick, only 29% of them are using public health facilities. And that's not because they don't want to, but it's just because they're not there. And then the rest are using either private for profit, or they're going to, for prayers and for traditional healers and all that. So I think more attention could be paid to the urban poor. Our research shows that, and other research, for instance, we've done an analysis of the existing demographic and health survey that are, national representative, and we've tried to extract the poor among the urban areas, and their indicators are consistently worse than even the rural areas, consistently. And for the first time, I think in history of Kenya at least, the infant mortality rate, the average for the urban is worse than the average for the rural, for the first time in history. And I think the argument you're trying to make is that as time goes on, as the urban population increases, and if the same process of urbanization continues, then more and more countries will find it difficult to meet development targets. Because we are thinking that as time goes on, the urban poor will start influencing national estimates. So maybe we'll reach a point where all these like MDG indicators will stagnate, because not much is being done for the urban poor. If you look at the trends for infant mortality in Kenya, for the rural areas, there has been a dramatic drop from the last demographic and health survey, which was in 2003. So between 2003 and 2008, there was a dramatic drop in infant mortality. But in urban areas, it's still a steady increase. So the urban have got worse, the rural have gotten poor, and finally now the urban have overtaken the poor in terms of poor health. And if you break it down with the urban poor, you find that the overall estimate for urban is actually closer to the overall estimate for the urban poor, because they are the majority ultimately in urban areas. So more attention needs to be paid to the urban environment.